Have you ever pondered what happens during a stroke? This seemingly simple question unravels a complex chain of events that can have devastating impacts on the human body. A stroke is essentially a brain attack. It occurs when the blood supply to a part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. This can lead to the death of brain cells within minutes. Think of it like a tree without water. Without nourishment, the tree can't thrive, and eventually it withers and dies. Now imagine that happening to your brain cells. There are two main villains in this story: ischemic and hemorrhagic strokes. Ischemic strokes are the more common culprits, accounting for about 8 out of 10 strokes. In this case, a clot or a mass clogs a blood vessel, cutting off the blood flow to brain cells. On the other hand, hemorrhagic strokes are caused by a rupture or a leak in the brain's blood vessels. This results in blood spilling into or around the brain, creating swelling and pressure and damaging cells and tissue in the brain. Picture a dam breaking, with the water causing chaos and destruction in its path. The consequences of a stroke are as grave as its causes. It can lead to long-term disabilities, affecting your speech, movement, memory, and more. In fact, it's the 5th leading cause of death, casting a shadow over the health landscape. Having illuminated what a stroke is, it's crucial to understand that time is of the essence when dealing with this medical emergency. Early action can minimize brain damage and potential complications. Now that we know what a stroke is, let's dive deeper into its signs and symptoms. How can you tell if someone is having a stroke? That's a question we all should know the answer to, as strokes can happen to anyone, anytime. Understanding the symptoms can potentially save a life. The symptoms of a stroke often start abruptly. One of the most common signs is facial drooping. This usually affects one side of the face. The person's smile may appear uneven or their eye may droop. Next, we have limb weakness. This can affect one arm, one leg, or both on one side of the body. The person may not be able to lift their arm fully, or they may stumble when they try to walk. Confusion is another key symptom. The person may seem disoriented, struggle with understanding speech, or have difficulty speaking themselves. This brings us to another symptom: slurred speech. The person's words may be difficult to understand, or they might not be able to speak at all. A severe headache is also a common symptom of a stroke. This is often sudden and severe, and may be accompanied by dizziness or a change in consciousness. The symptoms of a stroke can vary depending on which artery in the brain is affected. For instance, if the stroke occurs in the part of the brain that controls vision, the person may experience blurred or decreased vision in one or both eyes. If the stroke affects the part of the brain responsible for balance and coordination, the person may have trouble walking or experience a sudden loss of balance. It's also important to note that these symptoms can occur individually or in combination, and while they typically occur on one side of the body, they can affect the entire body in some cases. Remember, a stroke is a medical emergency. Every second counts. If you notice any of these symptoms, it's important to seek immediate medical help. Recognizing these symptoms quickly can make a significant difference, but how can we remember them? Stay tuned to find out. Ever heard of the acronym FAST? It's not just a word to describe speed. In the context of strokes, FAST is a simple yet vital tool to help you recognize the signs of a stroke in another person. Each letter in FAST stands for a distinct symptom of a stroke. F stands for face drooping. If you notice one side of someone's face drooping or it appears numb, it could be a sign of a stroke. Moving on to A, which stands for arm weakness. Look out for a sudden weakness or numbness in the arm, particularly if it's on one side of the body. S represents speech difficulty. Slurred speech or difficulty understanding what the person is saying might be another sign of a stroke. Finally, T is for time to call 911. If you observe any of these signs, it's crucial to act fast. Time is of the essence. The sooner medical attention is received, the better the chances of reducing the damage caused by a stroke. So, in the blink of an eye, you could potentially save a life. Remembering fast could save a life. But what about those symptoms that don't last? What if the symptoms are brief, you might ask? Well, this brings us to the concept of transient ischemic attacks, often referred to as mini-strokes. These are episodes where stroke-like symptoms manifest but only last for a short period, typically less than an hour. Just like a stroke, a transient ischemic attack, or TIA, is caused by a disruption in the blood flow to the brain. However, unlike a full-blown stroke, the blockage in a TIA is temporary and resolves before causing permanent damage to the brain. Although the symptoms of a TIA are fleeting, they are very similar to those of a stroke. This means that during a TIA, you might experience facial drooping, arm weakness, speech difficulty, and even a sudden severe headache. It's like a stroke's eerie doppelganger that vanishes as suddenly as it appears. But here's the critical part. A TIA is a warning sign, it's a red flag. It's the universe's way of giving you a heads up that a full-blown stroke could be on the horizon. Studies have shown that about 1 in 3 people who experience a TIA will eventually have a stroke, with about half occurring within a year after the TIA. So, what should you do if you or someone else experiences symptoms of a TIA? React as if it's a full-blown stroke. Remember the FAST acronym: face drooping, arm weakness, speech difficulty, time to call emergency services. Apply it. Even though the symptoms may disappear, it's essential to get medical attention immediately. In essence, a transient ischemic attack is like a fire drill for the brain. It's a practice run that doesn't cause any lasting damage, but it's a clear sign that something isn't right. It's a warning shot, a wake-up call, a sign that preventative action needs to be taken to avoid a potentially devastating stroke. So, if you're asking, what if the symptoms are brief? The answer is simple. Treat it with the seriousness it deserves. Because when it comes to TIAs, the old saying holds true: where there's smoke, there's fire. Transient ischemic attacks are a critical warning sign that should not be ignored. Now, let's address some common questions about strokes. One of the most frequently asked questions is, what are the risk factors for a stroke? Several factors can increase your risk of a stroke, including high blood pressure, smoking, diabetes, high cholesterol, and a history of heart disease. Lifestyle choices such as poor diet, lack of exercise, and excessive alcohol use can also heighten the risk. Another question often posed is, how can strokes be prevented? To mitigate your risk, it's essential to maintain a healthy lifestyle. This includes regular exercise, a balanced diet rich in fruits, vegetables, and lean proteins, and avoidance of smoking and excessive alcohol. Regular checkups to monitor blood pressure and cholesterol levels are also key in stroke prevention. Many wonder, what are the treatment options if a stroke occurs? When it comes to strokes, time is of the essence. Immediate treatment can minimize brain damage and potential complications. The specific treatment depends on the type of stroke. Ischemic strokes caused by clots are usually treated with medication to dissolve the clot. Hemorrhagic strokes caused by bleeding may require surgery to control the bleeding and reduce the pressure in the brain. A common query is, can you fully recover from a stroke? Recovery varies greatly from person to person. Some people recover completely, while others may have long-term or lifelong disabilities. Rehabilitation is a crucial part of recovery, and it often includes physical, occupational, and speech therapy. Lastly, what should I do if I suspect someone is having a stroke? Remember the acronym FAST: face drooping, arm weakness, speech difficulty. Time is critical. Call emergency services immediately if you notice any of these symptoms. Knowledge is power, and when it comes to strokes, it could very well be the power to save a life.